Thank you so much for being here, and for those of you joining us on the live stream, thank you so much for joining us too. And I'm really excited to do this. I'm really we have several other speakers, but I cover the majority of the lectures, and it's really an exciting kind of, still makes me nervous, but a very exciting week for me because I get to interact with so many of you. By the way, my email is there because during the course of these 5 very long and intense days, and we can't shy away from that, there will be many comments you want to make. You may want to correct me if you think I'm wrong, or you have a question, or you're wanting to maybe say, you should cover a little bit more of this, or something like that. Any kind of constructive criticism, positive, negative, or questions are welcome. So, the best way to reach me is through Dr. Jack. That is the email that comes to me that I will look at this week. And the reason I'm stressing this is because this course is there's so much content that we really don't have much like podium time to answer questions. Like in our Oasis conferences, we always build in a lot of time. But here we just have to kind of get through the material. So as I mentioned, this is a very intense 5 days that you will spend here, that we will spend together. And so, and I'm going to cover this actually in my first lecture about kind of, working together and when it's better to work alone versus working together. But working together is definitely, plays an important role, and for some people, really a very crucial role. So Michael was introducing you to your course dashboard, and there's a community there, and all of you are in that community, and you can be, sending messages saying hey, who wants to join a study group? Or even sometimes, people will want to, say, well, what town, what city do you live in? Because sometimes you may want to go to Starbucks and kind of meet up in person. So anything like that is possible. So what's the payoff for, you spending 5 intense days with me and the rest of us right now? Well, I think the payoff is really substantial. And most of you here are here because you're taking the initial certification exam. And that's a very difficult exam. I mean, all of the ABPN exams, I would say, are difficult, but it's not only difficult, it has a low pass rate. Let me be even more direct. Right, so over the last 2 years, 2021, 2022, we don't have the results, obviously, for this year yet, but for 21, 22, the pass rates were 79% and 81%. I don't remember which year had which one. So basically, around 20% of people do not pass this exam. Now, for the people who come, and are participants in the Beat the Boards course, the pass rate is 94%. So unfortunately, it's not 100%, but it's substantially better. And let me point out to you that the ABPN, the general pass rate of around the 80%, that includes everyone. It includes all of you who are averaging 94%. So you can imagine the people who don't come to the course, their average is going to be below 80%. So it's hard work, but it's going to be a very positive payoff in terms of you passing your exam. And of course, what is now called the continuous certification exam, that has a pass rate of 99%. As long as you do the work, you're almost guaranteed to pass that continuous certification exam. Really, the only people I've ever known who have not passed it were psychiatrists who had not been practicing recently at all. Maybe they were kind of stay-at-home parent or doing some other career, or they were doing something like working for an insurance company and doing medical reviews and things like that. They were not really in active practice. So with background, let's now begin, I think, in a very appropriate spot, how to study for and take your exam. So how to study for your exam, and then how to take it. So the days and weeks and months before the exam, and then how to comport yourself during the exam itself. And also touch on like how to comport yourself after the exam, because it is kind of a stressful time of life after you actually take the exam. And I'll describe why and what to do about it. So how to study for your exam. Well, let me be very blunt about this. Devoting time to study does not guarantee any positive payoff. There's even forms of like what you might kind of, or any one of us might call study, which actually could be counterproductive. It could actually be worse than studying. Now, how could this possibly be true? How could you be studying and yet like kind of be worse than where you started from? And it's because you can study in such a way that gives you the impression, and you build up the belief that you're actually progressing when you're not. And what happens is that you can become very familiar with the information. You know, I've had people, sometimes tell me, I've listened to lectures so many times I could almost like mouth along with the speaker, and then I took my exam and I failed. How could this be, Dr. Jack? And then I discuss it with the person, either at the course here. I have a lot of conversations at the APA too, because we're always there. And it's because it's just, you can't just kind of like listen and somehow passively you're going to get it. You have to actively manipulate the information. So, and I'll show you, let me go over this slide, and then I'll show you a very simple example in the next slide. So what does it mean to actively learn? You have to discern. You have to hear something I'm saying or something you're reading, whatever, and kind of say, oh, hold on, what's the implication of that fact for the way I will diagnose the patient? Will it lead me this way or this way? Or what's the implication for assessment, for the way I'm going to assess the patient, for the way I'm going to treat the patient? Distinguish so much, and I'm going to also be stressing this during the course, we need to compare and contrast situations. Like, what's the difference between somatic symptom disorder and illness anxiety disorder? So it's not only that you need to know, topic A, let's just say somatic symptom disorder, and topic B, illness anxiety disorder. You actually have to have a third area of knowledge, which is how are they the same and different? Again, that's a very simple example. It's not that complex how they differ. But if you haven't thought about it, you may confront on the exam a question that's really asking you to discern which one is like the little case vignette, whether it's more going to be somatic symptom, illness, anxiety, or whatever the other, distractors are. And if you haven't really thought like how those things that are in the differential, how they differ, you may be stumped. Your anxiety goes up and you're like, holy cow, I studied so much. I thought I knew this, but now I'm confronted with this question and I feel like I didn't even study it at all. One of the best ways to, especially if you feel like you're not a good test taker, or maybe you've taken the test and the exam and failed, is to do the following. Embody all the things you're learning into a real or imagined patient. So, people sometimes criticize me, we're going to be doing depression. I think that's tomorrow. It's like, I'm going to talk to you about depression for over 4 hours. And every year someone says, Dr. Jack, you're just spending way too much time on depression. I'm like, unfortunately, I don't think that's true, because, I'm aware of what I need to prepare you for the exam, and everything I'm saying is relevant. I could go faster, but it's all relevant. And it's just hundreds, if not thousands, of facts and factoids. But if you imagine having a patient, and most of you, or probably all of you, or almost all, are seeing patients right now. So every day you have an opportunity to, like, you know, even when you're driving home from work, commuting home, or maybe kind of jogging after work or whatever, imagine one of the patients you just saw that day, and just kind of imagine, doing like a more, a detailed interview with them. Like, what questions would you ask them? How about, imagine they were asking you a lot of questions about depression, and you had to, like, kind of do like some intense psychoeducation. Almost like talk it out, like you're talking to someone. Like, you asked me a question about something or other. Well, Dr. Jack, what else might be going on with my depression? And I'd have to, like, well, tell me more, And I'd have to, like, talk. Could I talk for an hour or two about depression? Well, you can try. You can actually kind of have this kind of, imagined conversation with a person. Now, if you may not have a patient with conversion disorder in your practice, maybe you've never seen one, but you can imagine. So when you're reading or listening to me presenting it, as I will be one of these days, you can just imagine a patient, call her Amy, call her whatever you want, have an imagined patient that will bring all those facts into one person that you can imagine. They're like an avatar for you. And again, imagine how would you be interviewing that patient? What would you be thinking is in your differential? How would you be psychoeducating the patient? And then questionize. It's a neologism. So, for example, let's say it's a disorder you don't have a lot of familiarity with. Dissociative amnesia. And you're reading the criteria of it, and you're like, okay. Well, now imagine, like, how would the ABPN test you on it? How would you, or if you were interviewing a patient, how would you turn those criteria into questions? I mean, on the ABPN, they don't say, like, here, which of these following five criteria are a criterion of dissociative amnesia? They're testing you on recognition of a disorder and not, like, identifying. So how, imagine those things. Like, how would you, if you were an ABPN question writer, how would you convert them into a question? And even in a different way, as I mentioned, also, how would you be interviewing a patient? When you're interviewing a patient, you're either asking a question or you're requesting information. How would you do that? So you see, these are all ways of actively manipulating. You're grasping. What does manipulation mean? Mani, it actually has to do with hands. So what we're doing is we're manipulating facts and concepts. Cognipulating, so to speak. So here's my very simple example, just to show you, we all know the criteria for major depressive episode. Right? We know that there are 9 symptoms and that we need 5 or more of them. Right? And it's got to be over 2 weeks, and it's got to be a change from kind of the prior or previous functioning. So here are the 9 criteria. What did I do here? I just changed the order of them. And when I changed the order of them, look what I found out. I found out that they really kind of fall into 2 categories. They're kind of what I would call psychological emotional symptoms, and then neurovegetative symptoms. And oh my God, there's actually, in a major depressive episode, there's more symptoms, 5 versus 4, of what I would consider neurovegetative. Significant weight loss or weight gain, so, weight and appetite changes, up or down. Insomnia, hypersomnia, so sleep changes. Psychomotor agitation or retardation. Fatigue, and difficulty concentrating. Now, I only need 5 symptoms, 5 or more symptoms. So if there was not that requirement that at least one of the symptoms has to be number 1 or 2, I could have all 5 neurovegetative symptoms and meet the criteria for major depression. But if someone had those 5 and not the emotional ones, maybe they have diabetes mellitus that's not well controlled. So right? Isn't that interesting? Have you thought of this before? Isn't that interesting? We all know these criteria. Now let me give you a couple other examples of kind of discernment and distinguishing things. So yes, again, I have to say, I need 1 or 2. So yeah, good. I need a depressed mood or anhedonia. Now, what is depressed mood? Now, if I ask a person on the street, they'd say, well, depressed mood means sadness. In fact, if I ask most psychiatrists, they would say depressed mood kind of equals sign sadness. Now, there's a lot of sadness in depression. But there's not only sadness in depression. We're familiar with 2 words that both start on the letter D, dread and doom. Some people with severe depression live in dread. Now, they don't come in and say, Dr. Jack, I'm really feeling bad. I have the sense of dread. Dread and doom. Have you ever had a patient use either one of those words? I'm not sure I ever had a patient. But how would that, if a person had those emotions, what word would they use? They could use the word depressed. What dread and doom? Dread is the poop is going to hit the fan. Something horrible is going to happen. I don't know what, but the earth's going to open up. I'm going to fall into some chasm. And doom is there's no way of escape. So they may present with anxiety, with I'm afraid, I'm anxious, I can't sleep. So you can have a person who kind of comes in saying they're anxious, but then they have all the symptom of depression. And then you're like, well, yeah. Some people's depressed mood includes those kind of anxious, dreadful, doomful kind of emotions. So a lot of interesting things. So again, really simple stuff that we all know. This is kind of my example of, active manipulation. All right, now let's go quickly through this. This part isn't going to take as long. So you need a time and a place for study. There's very few people in this modern world who are just sitting on time with nothing to do. I'm sure if you kind of saw your day, kind of like a stretch of time, I'm sure they're not big hour, 2 hour, 1 hour gaps throughout, where you're just kind of like, gee, I don't know what to do with myself, I don't know. Maybe I'll just take another walk around the block. No. So ask yourselves, between now and the exam, how are you going to clear up that time? Something has to give. Is it going to be your sleep? Is that a good idea? Maybe it's not a good idea. Maybe you have to do it. Is there something else you could give up? Are there some things you can say no to? Are you going to study an hour or half an hour in the morning? How are you going to do that? Is it going to be right before bed? Do you have enough kind of I couldn't study right before bed. I'm just too tired by the end of the day. It would just be, again, me pretending to study. Nothing would kind of go in. I don't have the mental energy to be doing all this manipulation. I want to watch some mindless YouTube video. And when? I mean, where? You may have a perfectly good place to study. Some people don't. I'm going to go home and study. I get home, kids, whatever. Okay, there goes my plan for, okay, I'm going to go to work half an hour early. I'm in my office hey, Dr. Jack, by the way, and it's sort of someone wants to ask me about something, it's I've had people who told me, or one person who told me, I just drive my car like half hour earlier than I drive to work, and I stop in a McDonald's parking lot. And I just sit there in my car to study. Like, you know, I just need a place where no one's going to be bothering me. So when and where? Something else is going to have to give way. And I want you to think about this. It's not just going to happen on its own. Individual and group study. Now, I'm biased. I'm a solo, kind of a solo learner. And I find individual study to be the foundation. For some people, that's enough. For other people, you want to supplement it with the group study. But when a group, be very clear what you're getting there, because it's very easy in a group to pretend you're studying. Tell yourself you're studying, but you know, people are just chit-chatting. And even when you get into the material, you know, people might be discussing things you have like no interest in. They're either irrelevant to the exam you're thinking or stuff you know, and it's just like, what am I getting out of this? So, you know, here are some suggestions on how you could use group study. You know, you can kind of in a way, almost pretend it's like an oral board and ask each other questions. You know, like what are good second line medication treatments for PTSD? That's a very, very common question, or you know, however they phrase it for the boards. You know, so have a very clear plan, agenda for group study, and then kind of kind of hold yourselves accountable to that. Again, study time does not actually equal learning. Here's some mindsets, the study mindsets. I will make elaborate plans and will not have the time, energy, or motivation to fill all of them. So we all kind of think we're going to do more, study more, get more done than we actually will. And you just have to accept it and do your best. Do your best. Don't beat yourself up over like how badly you did last week. Doesn't mean you should ignore it. You should say, what could I have done better? What do I need to do better this week? So definitely evaluate, but don't beat yourself up. Why should you not beat yourself up? Because you're your only resource. You know, in a way, you're beating up the person who's going to be taking the exam. It's kind of counterproductive. So, you know, I mean, definitely, you know, debrief yourself and kind of think about it, but don't be too like emotionally hard on yourself, because then you're just going to get amotivated, overwhelmed, sad, and kind of wanting to like not to give up. Or you're going to be studying while you're preoccupied with all of these kind of other thoughts. I will just do my best given the constraints in my life. It's all you can do. Every minute I spend on active learning incrementally improves my chances of passing. That's why even like spending 5 minutes doing like, I don't know, three multiple choice questions, or, you know, during lunchtime, spending 10 minutes reviewing criteria for whatever disorder you've been kind of like listening to my lecture about or whatever, and you're kind of, let me kind of look at the DSM and look at the criteria again, or look at the syllabus or whatever, or imagine that patient, you know, I'm psychoeducating. Rather than fretting about all I should have done, I'll focus on all the additional minutes, hours I still have available to help my chances. So, you know, passing and failing is black and white. But your chances of passing and failing are not black and white. Every 5 minutes is like is getting you closer. If it's really effective study, it's getting you. You're learning some facts, getting some information that you're getting into your knowledge base, into your understanding that will help your chances of passing the exam. Prior to the exam, do not just practice questions, but do practice tests. Because I want everyone here, everyone taking the exam, to know what your pace of answering questions is. Because one of the most common worries is, What if I run out of time? I know I'm going to run out of time. I'm going to run out of time. Now, to me, that is the worry, the concern that has the most emotional worry, is associated with the most emotional worry with the least amount of actually factual the reality of running out of time. Most people do not run out of time. But I don't want you to worry, am I or am I not? Do a practice test and set your time and kind of like assess your time. I was able to do 100 questions in 100 minutes. Right? You have like a bit over a minute a question. And for the continuous certification exam, you even have more. For us older folks, if we take that CC exam, it's sort of like we think more slowly, so that we, for all of the MOC exams, they always give you more time per question than the initial certification. But in any case, you have more than a minute a question. So know your pace so you don't have to worry about it. Also, when you're at the exam, I'll talk about this later. If you're at the exam, if you get done like in 50% of the time or 40% of the time, don't think like, I must have done something wrong. Some people are very fast exam takers. And you might be really working through the last minutes of what you've been given for your exam, and that's okay too. The only thing that's not okay is running out of time. But again, you're going to be able to, you should establish your pace and then fix your pace in the rare instances where you really are too slow. Before the exam, sleep and hydrate. You have to be rested. The initial certification exam is going to be 9 hours long, including the lunch break. That takes a lot of physical and mental stamina. No last-minute medication experimentation. Some people will like, can I take some propranolol before the exam or lorazepam? I'm like, hey, knock yourselves out. I'm fine with that. But don't do it the first time at the exam. And the other thing is, don't say like, okay, I'm going to try a milligram or 2 of lorazepam ahead of time. And Dr. Jack, I felt pretty good. Really? And when did you take it? Well, I took it at 8 in the morning. Good. How did you feel 4 p.m. in the afternoon? And they're like, what? Well, yeah, the exam is 9 hours long. How is that medication that you took affecting you during those? Maybe you're doing like better, you're less anxious in the morning. In the afternoon, you're ready for a nap. I will study to the best of my abilities. I will do my best in an exam. I cannot control the outcome. I may fail, but I want to fail while being true to myself and trusting myself.